Welcome to this explainer. I'm so glad you're joining us. I'm speaking to you directly from Next Level Speech and Physiotherapy Center, Dubai's premier rehabilitation clinic right here in JBR. Look, whether you're actively navigating speech concerns right now or just dealing with really stressful mealtimes, we know exactly how overwhelming parenting can be. So today, we're giving you a warm, child-centered guide to understanding what's perfectly normal and when it might actually be time to ask for a little helping hand. Okay, let's dive right into this. Chances are you've asked yourself some pretty tough questions lately. Maybe you're sitting at the dinner table, your toddler is flat out refusing everything except plain pasta, and you're just wondering, why is this so hard? Or, you're at the playground hearing other children chattering away, and you catch yourself thinking, my child isn't speaking much. Is it a delay, or is it just because we speak 3 different languages at home? I want to immediately validate those internal anxieties for you. Parenting in our vibrant, incredibly fast-paced city comes with some really unique daily stressors, and it is completely normal to feel unsure about these critical milestones. But I want to assure you right off the bat that you are in highly experienced hands here. At Next Level Speech and Physiotherapy Center, this isn't just theory for us, it's literally our life's work. Over our 11+ years of hands-on clinical practice, our dedicated team has supported over 7,000 children and their families. We've seen the tears of frustration, and trust me, we've celebrated the incredible breakthroughs right alongside our parents. We know exactly what to look for, and more importantly, we know how to help your child thrive. So, let's start with Section 1, Parenting in Multilingual Dubai. And that flows right into Section 2, Bilingual Speech, Myths and Reality. In a place like Dubai, a child might easily hear 3 different languages before they've even finished breakfast. They hear Arabic at home, English at nursery, and maybe Hindi, Tagalog, or Russian on the weekends with friends. For the families we see every single day at our JBR clinic, raising children across multiple languages isn't a choice, it's just the reality of life. But when a child isn't talking quite as much as expected, this beautiful linguistic diversity suddenly becomes a source of profound worry. And this brings us to a really crucial part of our clinical work, untangling outdated advice from genuine developmental facts. In our clinical experience, getting the assessment right is absolutely everything. Because if we tell a child with a true delay that, oh, it's just the languages, they miss out on absolutely crucial early intervention. Conversely, treating a normally developing bilingual child for a delay they don't even have, that just causes needless stress for the whole family. We actually spend a lot of time flipping a very common parental fear on its head. So many parents tell us, my child mixes Arabic and English constantly, they must be so confused. Well, in our clinical experience, that is a total myth. Our findings consistently show that mixing languages, what we professionally call code switching, is not a sign of confusion or delay at all. It's actually a perfectly normal, highly sophisticated feature of bilingual communication. Your child might use a word in one language because it just comes more easily in that moment, or because both languages are brilliantly active in their mind at exactly the same time. It's kind of like having dual processors running at full speed. I really want you to take this next point to heart. A child does not have to choose. We regularly, and I mean regularly, hear from parents who are told by a nursery to drop their mother tongue and speak only English at home to quote-unquote help their child catch up. As specialists, we literally have to be crystal clear here. This advice is incredibly outdated, and it is not supported by evidence. Dropping your home language actually removes your child's strongest linguistic foundation. Strong home language development strongly supports the learning of additional languages. You should absolutely speak to your child in the language you speak most naturally and fluently. A child does not have to choose, and honestly, neither do you. So if mixing languages isn't a red flag, you're probably wondering what actually is. Well, at Next Level, we look for limited communication attempts across all languages, not just one. Are they missing basic milestones like first words or word combinations? Are they having difficulty understanding simple instructions even in their strongest language? Or are you seeing a lot of frustration, withdrawal, or maybe behavioral issues tied to their inability to communicate? If a child is struggling to communicate meaningfully in any language, that's when it definitely warrants a professional assessment. All right, let's move on to Section 3, Picky Eating or Feeding Disorder. We're going to shift gears to another major source of daily parental stress that we treat every single day at our clinic, mealtimes. Now, mealtimes should ideally be this great point of connection. But let's be real, for many families, they are an exhausting battleground. You might have a baby who takes forever to finish a single bottle, a toddler having an absolute meltdown over a non-pureed texture, or a child who coughs their way through every single meal. These struggles are incredibly common, but more importantly, they are highly treatable. Now, you might be a little surprised to learn that speech therapists are the ones treating feeding issues, but the connection is actually wonderfully simple, and it's all based on anatomy. The exact same muscles your child uses to speak, the lips, the tongue, the jaw, the throat, they're the very same muscles used for eating and swallowing. Because our speech therapists at Next Level train extensively in oral motor function and swallowing mechanics, we are actually the primary specialist for diagnosing and treating childhood feeding difficulties. It's all the same system. Now, we do need to make a very important distinction here. Most toddlers go through a phase of food refusal. That is developmentally normal picky eating. It requires a ton of patience, yes, but it usually resolves itself. A genuine feeding disorder, however, is something entirely different. It involves a severely restricted diet, a level of distress that goes far beyond typical toddler fussiness, actual physical difficulties with the mechanics of swallowing, or serious nutritional concerns. Knowing the difference between the two is absolutely key to getting the right help. If you're sitting there wondering where your child falls on that spectrum, here are the specific presentations we consistently see in our clinic that warrant a proper assessment. If your baby takes 45 minutes to finish a bottle and just seems completely exhausted afterward, that usually points to an oral motor difficulty. If your child eats fewer than 10 foods and goes into an absolute panic at new ones, we're definitely beyond normal picky eating. Frequent gagging to the point of vomiting or coughing and sounding gurgly during meals, which, by the way, can be a real safety concern called aspiration, means it is definitely time to reach out to our specialists. Which leads us perfectly into Section 4, our comprehensive assessment approach. If any of those feeding or speech signs resonate with you, the very next step is finding out exactly what's going on. And this is where our approach at our JBR clinic truly sets us apart. You see, one of the most damaging errors in pediatric therapy is assessing a bilingual child using tests designed for monolingual children. It literally leads to massive misdiagnoses. At Next Level Speech and Physiotherapy Center, we assess the total picture. We utilize bilingual norms and completely customized tools to ensure we get the diagnosis perfectly right. We want to demystify this whole assessment process for you, so taking that first step feels manageable and, honestly, reassuring. Step 1 is always a detailed conversation with you, the parents, because we need to understand the full history and environment. Step 2 is direct clinical observation. We're watching how your child plays, how they communicate, or how they manage food in their mouth. And Step 3 is our customized assessment, where we interpret the results against bilingual norms and your child's holistic, unique profile. We don't guess here. We gather precise clinical data. Finally, let's look at Section 5, empowering families through therapy. Once we have a really clear assessment, we move into therapy. And I want to be super clear about our clinical philosophy here. There is absolutely no cookie-cutter program that works for every child. Whether we're supporting an articulation delay, a severe feeding disorder, or a really complex bilingual speech profile, our therapeutic methods are entirely customized to empower your specific child. The absolute heart of our approach, particularly when we're dealing with feeding and sensory challenges, is that we work with a child's nervous system, not against it. For example, if we're working with an autistic child who has severe sensory-based feeding difficulties, applying pressure, that will only entrench their anxiety. Instead, our therapy uses gradual, highly supported exposure to expand their tolerance for new textures and tastes. We move at a pace that deeply respects the child's sensory limits, slowly turning that fear into real confidence. Because ultimately, mealtimes happen at home, right? They don't happen in a clinic. And the exact same goes for everyday conversations. Family involvement is the absolute core of our whole philosophy at Next Level. We don't just treat your child in an isolated room behind closed doors. We actively equip you, the parents, with proven, evidence-based strategies. We help you create an environment at home that supports continuous progress, dropping your anxiety levels and fostering a true, joyful connection with your child. We've covered a whole lot today, from the realities of bilingual development in Dubai to the often hidden complexities of feeding difficulties. I want to leave you with this final, empowering question. Are you ready to find the answers your child deserves? If mealtimes are a daily battle, or if you are quite literally losing sleep wondering about your child's speech, you do not have to carry that worry all by yourself. There is absolutely no downside to finding out. Reach out to our team at Next Level Speech and Physiotherapy Center. Let's find that clarity together.